The healthcare system needs to catch up to young adults who are using technology to manage their well-being and to access services like no other generation, the Canadian Medical Association says in a new report. Technologies such as virtual monitoring and artificial intelligence can help address what the CMA calls the growing healthcare generation gap, the result of young adults adopting technologies on an unprecedented scale. Young adults are adopting wearable health monitoring devices and are less concerned about privacy than any other group, according to the Canadian Medical Association. Mark Lenehan, The Associated Press file. What we are seeing is that Canadians are ready but the healthcare system isn't, said Dr. G. Osler, incoming president of the CMA, which represents 85,000 physicians and doctors in training. To ensure we are ready to tackle this new wave of tech-savvy patients, we need to have the right policies as well as action plans to futurize our healthcare ecosystem, added current CMA president Dr. Laurent Marcoux. The way this generation manages and tracks their health is much different than any other demographic group. The report, based on results of an Ipsos survey in May, comes on the eve of the CMA's inaugural Health Summit in Winnipeg that will assemble more than 700 physicians, health policymakers, patients and others to discuss how technology can promote better health and more efficient delivery of care. Article continued below. The survey found that 18 to 34-year-olds are more likely to take advantage of virtual and in-person doctor visits than the general population, self-reporting at least 11 visits annually. The young adults are using various forms of online technology including wearable heart rate and blood pressure monitors and are less concerned about privacy than any other group. This is a generation that has grown up with tech, said Osler, suggesting that the propensity to access healthcare is at least in part a function of their familiarity with newer technology. They are interested in wellness care and not just sick care. They're managing their own health more than any other generation and that's a good thing, Osler said in an interview. This generation is accessing the health system more than anyone expected. The survey of more than 2,000 Canadians found that 7 of 10 would take advantage of virtual doctor's visits and many believe virtual systems can lead to more timely care, although the data shows that under 1 in 10 have had a virtual visit, with the level higher among those under 35, parents and among BC and Ontario residents. 1 in 4 said they have a mobile device that monitors health, higher among those under 35, the university-educated and parents. Most people said they would prefer a health monitoring device that is less invasive, and respondents said they are concerned about the accuracy of online diagnosis and the potential loss of human touch. Osler said technology can promote a more cost-efficient system and could reduce wait times by easing demand for in-person visits, but suggested that a balance must be struck so that virtual medicine functions only as a complement to hands-on care. I don't think you're going to see healthcare professionals replaced by robots. Still, she said doctors need to be prepared for changes to how technology is used to deliver healthcare at a time when augmented reality startups in the field are focusing on everything from neuroassistants for autistic people to holographic surgery headsets. Article continued below. This is a wake-up call for healthcare policymakers, physicians, and healthcare innovators to find out how we can leverage technology to deliver better outcomes, Osler said, adding that Canada lags other G7 countries in adoption of health tech. There are silos here and there, but nothing is being adopted on a national scale. We have to look at how we prepare to address the needs of all generations, particularly this tech-savvy generation, so that tech can improve health in the system. The survey results highlight the need for policy and action to urgently scale up